Let's have a look at the kit components. The kit contains 1 bottle of reagent 1, 1 bottle of reagent 2 and 1 vial of CRP Calibrator. This calibrator has a value of 60 mg per dl. The kit also contains 1 instruction of use. We recommend all the users to read the instruction for use thoroughly before using the test. Before having a look at the procedure, first let us understand how to prepare the working solution. To prepare the working solution, we need to take 4 part of R1 reagent and 1 part of R2 reagent. As per the procedure, we need to take 2 different tubes, one for calibrator and one for the test. In the first tube of calibrator, we need to take 1 ml of working reagent and 5 microliter of calibrator. Now, as per the procedure, we need to take 800 microliter of R1 reagent into the test tubes. Now, discard the tip and take 200 microliter of R2 reagent. Discard the tip and mix the reagent properly. Before adding the sample, make sure to open the program of CRP which you have already saved into the instrument. Here we are using AT Smart instrument. So main menu of the instrument, select test menu and go to the CRP program. You can see all the parameters. You can cross verify with the packing set itself. Now press execute and first wash with the distilled water. For the calibration, select standard. Now take 5 microliter of standard. Wipe the tip with a tissue paper to avoid excess of standard and mix with the calibrator tube. Now aspirate to the instrument. After delay time of 5 seconds and reading time of 120 seconds, instrument will display the new factor. Now here is the new factor is 276.4. Now we can aspirate the serum sample. So for serum sample, we have to take 5 microliter of serum sample. Wipe the tip to access the serum sample. Now take tube, mix with the reagent properly and aspirate. After delay time of 5 seconds and reading time of 120 seconds, instrument shows the serum sample value, that is 3, which is normal. This is the exact procedure to perform the Turbilatex CRP reagent.